Yeah, you were talking about psychological flexibility being within the individual and its relationship to the social um, world. Is that? Yeah. Yes. Right. Mm-hmm. Mm-hmm. I didn't see sicko. Yeah. Yeah. Well, 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 that's why I keep talking about shared values. One of the things we're doing in our school intervention, the teacher well-being project, is in the first session we're focusing on people diffusing from their own thoughts and feelings and looking at the value of caring for themselves. We emphasize that um, it, because that I feel like only when I begin to feel safe inside my skin with these thoughts and feelings, and I can kind of hold them lightly, might I be willing to venture out and be in greater contact with someone else. But what we do by our second session is we get people to put up their values, and we have them use dots to identify the ones that they share. It's not to say that the ones that nobody else share aren't values that are perfectly valuable. But what inevitably emerges are a set of shared values. And when you're talking about is a group of people fused with a certain view, to me it's a shared view, and you can deal with that in terms of the prevalence of that view. And so what would diffusion at a group level be? That would be interesting. I'd want to talk about not only this individual taking a lighter hold on this point of view, but a whole group of people doing it. I think that would be interesting. But I think the way you do it is by, first of all, helping individuals to become more psychologically flexible, uh, and then supporting other people in doing it. Right. Yeah. Right. You know, well, you know, well, yes, right. Well, a- as you're talking, I'm thinking we're doing these workshops with teachers, and then we're trying to consult with the leadership of the school to try and create this ongoing environment beyond these workshops. And as you're talking, I'm thinking that there's some good ideas there in terms of this sort of verbal play that would make it more normative for people to throw out ideas and just have ideas and not, we don't have to fight over them. You have your ideas and I have mine. Just the kind of thing you were saying, but to really kind of create that as a culture. When Georgia, who for the benefit of the rest of you is my wife and runs the early education program, and she and I did ACT workshops for her teachers. There are 50 teachers in preschool. And when they began to introduce new programs after we did these workshops, she would introduce them by saying, I'm having all these thoughts about this may be difficult and so on. And she just encouraged everybody to be open with their thoughts and feelings about the obstacles to doing this and so on. And so I think you're right that we need to find ways to create to almost formally create a culture which is psychologically flexible. And I hope you will help me do that in the months to come. Yes, yeah. Well, one of the measures that we're proposing to use is a measure of social cohesion that gets at the degree to which people trust each other and things of that sort. So that's one part of it. But I think you're pointing to another aspect of it. I'm involved in this effort in Lane County to try and improve public safety. That op-ed piece I sent you was prompted by that. And we're doing public meetings where the people that you can expect to come to these meetings are people who are angry about crime and angry about those people and so on. And so it would be interesting to not only try some things to encourage this sort of more pragmatic way of looking at the ideas, but to measure it. And I'm not quite sure how you'd measure it, but I suppose there'd be items like I'm willing to consider a lot of different views, or I don't know. What do you think? I, you know, I think you could frame the terms of a discussion in a way that would make it a little harder for people to simply disagree. And in fact, that op-ed piece I sent you was designed to do exactly that. The critical features of a nurturing environment? Yes, absolutely. Yes. The number one is the nurturing environments minimize biologically and psychologically toxic events. I'll skip the biological for the moment, but think about the coercive family processes. Not just abuse, but simply teasing, criticism. These are aversive events that are that increase antisocial behavior and contribute to substance use and depression and so on. Okay, so those aversive events are one of the first things we need to do is reduce the level of those kinds of aversive events in families and in schools and in neighborhoods. So now how is that linked to psychological flexibility? Well, as I said in my talk, I think one of the things we badly need is some epidemiological research, which I think will show that when people are teased, are criticized, or harassed, being right becomes more important, being safe becomes more important, avoiding this stuff becomes more important, and people become more experientially avoidant. I think that that's highly likely. So that'd be, yeah, yeah. I think it's the most important example. No, actually, repeat the last your last sentence. Right. Absolutely. Right. Exactly. Right. 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 Girl committed suicide. Yep. Well, I mean, as you're talking about that, what I'm thinking is that, um, and I have seen this in our work in schools, that I think that those attacks are in the service of me. You know, if I'm attacking you, it's in the service of my being okay. It's in the service of my escaping the things that I'm threatened by. Um, you know, so it's certainly experiential avoidance. Um, Hmm. Oh, absolutely, absolutely. Well, one of the four characteristics of nurturing environments that I've listed is itself psychological flexibility. So, yeah, that's unquestionably the case. I mean, in order for me to be, caring toward my child, I have to have feelings that they're wrong or that they're bad or that something bad's going to happen to them. And in the context of having those feelings, still be caring toward them. So, yeah, I think the diffusion processes are extremely important in that. Yeah. Mm-hmm. No, no, no. Well, you're pointing to actually there's a specific thing that I keep sort of struggling with in doing these workshops because I think I can get people to the point of okay, I'm willing to be caring, I'm willing to diffuse from my thoughts and feelings and so on. But the question I tend to ask is, do you value being cared for? In a just a basic like you're holding a cat who's calm. Do you want to have that kind of comfort and care for yourself? And they say yes. And I say, do you want that for other people? And they say yes. And then if they mean that, then I think I've got them. That because where I'm trying to go with this, and we actually give them assignments coming out of the second workshop is to act in the service of that shared value. If you want the relationships in this school to be positive and caring and respectful, and respect, by the way, comes up in every school I've been in as one of their key values. If you want those relationships to be like that, then are you willing to take action in the service of those values? And what will come up for you when you say, yes, I'm going to do something that's bold and goes beyond what I've done? I'm going to reach out and talk to so and so. Well, what will come up for you? He doesn't deserve it. He's been so nasty to me. And so I talk about forgiveness as being willing to have those feelings of hurt and anger and so on, and nonetheless act in the service of that value. So that's sort of the way I've been trying to encourage people to step beyond the barriers to their being caring toward others, even if they aren't sure that it will be reciprocated or that the other person deserves it. And that's what comes to mind when you say that. I'm not sure that's completely responsive. Yeah. Uh, well, but there's one other thing that you said because when I talk about I want to see somebody do a diffusion study. Don't mention values, nothing about values, just diffusion. Does it increase people's care that there may be something emergent in psychological flexibility in groups? Okay. Ah, yes. Yeah, Steve has pointed out that people don't generally come to a therapist to get rid of their prejudice. And so it is a problem. You wrote a question to that effect, didn't you? Uh, um, I, I, you wrote the one about stigmatization? Yeah. My first thought is that most prevention programs try and avoid stigmatization because um, they aren't even talking about it. They're simply helping people develop skills or doing other things that make it less likely that they'll have these problems. But they don't generally talk about it in terms of mental health. In fact, I was on this committee on the IOM Committee on Prevention, and the title of the book, which I have here, is "Preventing Mental, Emotional, and Behavioral Disorders Among Young People." Well, I fought with them to not use that title. This book is about preventing mental, emotional, and behavioral disorders, and there were psychiatrists on it, there were epidemiologists, and so on, and they just insisted. And I kept saying, it's a stigmatizing term. People will turn off when you talk about mental disorders. And by the way, the criminal justice system and the education system don't use that term. But but for many of the people on that committee, it's a reified construct. There are mental illnesses. I think it's highly problematic for some of the reasons you suggest and others. But I think that if you look inside most of these preventive interventions, they are not stigmatizing in that way. But there's still the issue of whether or not you can get ACT kinds of things, how you put them into the media, how you encourage people to adopt these approaches. We need some media research on this. Imagine that you had to make 30-second spots favoring psychological flexibility. I think that would be an interesting exercise to just write scripts for 30-second spots that model psychological flexibility. These are the ways that we're going to get this out into the population, is to translate it into these little bits. Though, don't get me wrong, books like Get Out of Your Mind and Into Your Life and The Happiness Trap are certainly doing a lot in that regard. Does that help? I just lost the sound. I don't know if you did also. Uh, I am not hearing anything. Hmm. Oh, I do. Where were we? Yeah. Hmm. No, they don't. Hmm. I right. So so their response was, "We're behaviorists, not pragmatists." Well, a couple things. And this is not necessarily responsive to what you're saying, but it comes to mind, and I always want to mention this in a public health context. Um, there's we've made enormous progress in behavior analysis by insisting that we show strong, big effects of relationships between independent and dependent variables. But from a public health perspective, you can have an intervention that has a very small effect, but has a huge public health benefit. For example, about 25 years ago, it was shown that if a physician gave advice to a smoker to quit, just 30 seconds, I see you're a smoker, and as your healthcare provider, I think it's my responsibility to suggest that you quit. That about doubled the rate of people quitting from about 2% per year to about 4%. Well, that's nothing. That's a very small effect. Well, in fact, if you multiply that across the population, that can have a very significant effect. And so small effects in a public health context shouldn't be ignored. Now, the other thing that comes to mind is I'm working on a chapter with Sigrid Glenn, and I don't know if you're familiar with their concept of meta contingencies. Um, and there's a tendency for people to say, well, you've got to get down to the individual contingencies for the individuals involved in the process. So, for example, if a hunter-gatherer group gets very good at hunting, and the fact that the meta contingency is that their food production selects that group, and the group expands, and pretty soon there are a number of groups and tribes that use this hunting method because it's expanded, because this group expanded, because they survived. And so you can get down into the contingencies where, they made this barb on the spear that stuck in the animal and more effectively killed it, and that was praised by someone else, and so on and so forth. And you can do that, and that's could be very useful, but it's not it isn't necessary necessarily. If a contingency between a group practice and an outcome can be reliably shown, then that's, as Skinner used to say, a fact in the bag, and you can use that. So I don't know. That's sort of my reaction to it. And you're right that science and I think more generally academia is massively focused on who's right and who's better. I mean, just think about it. Here you are, and you're in graduate school, right? You're in first grade. You go, I know, and you're in middle school. I know. And, you're always one of the kids who knows stuff, and you get richly reinforced for knowing all this stuff. And now you get a PhD, and you look around, and you're maybe in a university, and you look around, and everybody else is pretty smart. But what have you been reinforced for your whole life? Being right, knowing something, knowing more than somebody else, right? And so I think universities are highly problematic for just that reason. The kind of comparison is just, I don't know. They need a big ACT workshop. And Steve is the smartest person at Reno, and he should do that workshop. I can. Yeah. Predicting what? Uh-huh. Oh, Jackie, I think, described that. Yeah. Well, well, yeah. Well, yeah, that's an interesting issue. I mean, I think what you said conceptually is that men are experientially avoidant, right? I mean, well, in the sense that I mean, I don't think you need to go very far to get examples of men, you know, actually in this the stuff I was talking about, Phil Jackson and so on. I also got an earlier era of athletes to because I'm trying to have some models of how men can become psychologically flexible, and it's not unmanly to be that way. Phil Jackson's the winningest coach in basketball, but I got Jerry Kramer's book, Instant Replay. Jerry Kramer was a star guard for the Green Bay Packers when Vince Lombardi was the coach, and Vince Lombardi was one of the most successful coaches in football. This is back in the 60s. And he kept a diary and wrote this book on this championship year of the Packers. And he said they used to call him Dr. Lombardi because when he was through talking to you, you forgot about your injuries and you got out there and you played. And in fact, um, Kramer discovered that there was a piece of wood lodged in his leg, which had been lodged in there since he was an adolescent, and he just hadn't realized it. So talk about not being aware. Um, so it really seems to be there, but why isn't the AAQ picking that up? We're doing a pilot study where we added some items to we created a teacher version of experiential avoidance, and we've added some items that we think might discriminate men from women, but we haven't analyzed the data, so I don't know what that's going to show, and I can't even remember what the items were. But what do you think would be items that would discriminate from men? Well, okay, but here actually that's a good example. I mean that's certainly one that we would agree is the kind of stuff we're talking about. I have to be tough, but doesn't that also come up when they think, gee, I got drunk 3 nights last week and didn't do my homework. Maybe I should go to the student services. Oh no, I'm not going there. I mean, I have to be tough. Uh, I have to be tough also excludes admitting that you have any of these problems. You can ask Steve, but I don't think anyone has yet done a meta-analysis of the um, clinical trials of ACT. I suspect that you'll find that there is um, plenty of evidence that ACT is effective with men, though it would be interesting to see if it's as effective as it is with women. But it may be that it's as effective with men when they're properly cooked, when the guy's wife has left him and he's lost his job and so on. Then he's maybe willing to look at a different orientation. I'm treating a guy right now, and I'm treating him. I asked to. I'm doing pro bono work, and I asked to see a guy because I wanted to deal with this, and he's certainly making progress. And anyway, your thoughts on any of that? Yeah. Right. Exactly. Okay, so pick an item on the AAQ that and walk me through how that might change. Okay. Hmm. Yeah. Yeah. Okay. So the guy comes to arrives at UNR saying anxiety's bad. Oh, okay. Yes. Yeah. Right. Hmm. Is there evidence of iatrogenic effects with men? Is this can't hear? Well, uh, well, I mean, I just week before last doing a workshop, and I ask people to just sort of notice their thoughts. And as I'm doing that, I worry a little bit that, some people, this could be really spooky. I have thoughts. So yeah, what I always try and do is, you know, try and attach little bunny rabbits to those thoughts. Uh, Joke about them, make light of the thoughts. You know, but interesting. Mm-hmm. By the way, I just have no. Right. Hmm. Right. Right. Well, and by the way, did well, I mean, let's face it, we're no longer of any evolutionary importance. You can fire a missile by pressing a button, don't need strength, right? Um, the rates of men going to college are lower than those for women. We're about at the point where there are more women employed than men. And then there's turkey baster babies. We're done. I mean, between that and cloning, it's forget it. Well, well, I mean, they're also. I mean, look at the costs of men. I mean, count the number of people in a penitentiary. Look at crime and antisocial behavior and abuse and so on. Uh, but we are failing to socialize men um, massively, and it's very costly to society. Um, Hopefully we're going to do something about that. Nicholas Kristof had a column in the New York Times just last week on this, and the boys aren't learning to read as well as girls. They don't do as well academically generally, except for the top math students. They're still men. Yes. So yeah, let's not get too depressed. Yes. Right. Hmm. So so does alexithymia have the same relationship to psychological outcomes that the experiential avoidance does? And are you suggesting that are men higher in alexithymia than women? Boy, if anybody's got a data set, that would be very nice because you could take all these psychological outcomes including externalizing problems and play with the relationship of the AAQ and alexithymia measure to these outcomes separately for men and women. That would be very useful. Hmm. Interesting. By the way, talking about men crying, Uh, I caught the end of a documentary about the relationship between Larry Bird and Magic Johnson, and I was in tears as Magic Johnson was describing how when he came down with the HIV virus, how distressed Larry Bird was and how he called Magic and was just being caring toward Magic. Here are the two dominant basketball players of the 1980s, one white, one black, and just this loving relationship. It was really beautiful. Are you the one who Jeff Sprague was telling me about yesterday? Uh-huh. Okay. Yes, I think positive behavior support does exemplify the characteristics of nurturing environments. And that's actually been influential in my thinking. So, and I hear you might be visiting Oregon. Okay. Um, you know that Jeff and I are doing a randomized trial of PBS for middle schools. And one of the ways, and we're doing a randomized trial of ACT for teacher stress in middle schools, and we came to that in part because of the tension among staff members in middle schools that gets in the way of their implementing positive behavior support, especially that kid doesn't deserve it, and let's talk about 6 ways to punish this kid because they're a bad kid, all those things that get in the way of PBS, but I think they're also ACT relevant. Mm-hmm. Well, you might be interested. Yeah, after we did the ACT workshop for the early education program that my wife runs, the state said they wanted to implement positive behavior support in the preschools. We got 19 classrooms. And so, in fact, ACT was very instrumental. I've been waking up next to this woman for 15 years as she's been the director of this thing, and she's going, they're not doing what I, was trying to get them to do and so on. And since she's done the ACT stuff, it's been much easier to implement. She implemented that, but she also implemented the PATHS program for young children that Celine Dimitrovich evaluated. And it's been very interesting because she feels like the ACT work was very helpful with teachers. And of course, she tended over the years to hire teachers who were into direct instruction, behavior analysis. Well, a kid gets upset, you just say, oh, come on, it's time for the next activity. And you don't necessarily pay much attention to their feelings. So the incidental teaching about emotions that was prompted by Celine's program, but with George's approach, they do all of this in the moment incidental teaching, especially relevant for feelings. But the teachers being willing to have their feelings about that child being upset was one of the things that was important, in getting that going in the preschool. So if you come up here, you should visit the preschool. I think you'd enjoy talking to Georgia. Well, hey. Yes, this was great fun. Thank you for inviting me. Yeah. Yes. Did you see the précis I sent you yesterday for the consortium? I think there's a decent chance that we could get something going in one or more neighborhoods in the near future. So if we do, we're going to need to whip up some measures of, especially organizational um, uh, cohesion, social cohesion in organizations. So, oh, absolutely, absolutely. It has been my great pleasure. And let me also say once again that I do thank you for the work that you've done over the years because we and an increasing circle of friends are really live this kind of life, and it has added immensely to the quality of our lives. So thank you. Yeah, and and to your students, I just say keep them humble if you can. Okay, good talking to you.